We all have questions about our health, our careers, and the world around us. This is Ask. Always stay knowledgeable. A BlueCross BlueShield of South Carolina podcast where real experts break down the topics that impact your life every day. Simple, clear, and built for you.
Welcome to today's episode. We're going to be talking about understanding your health insurance. I'm joined by Stephanie, our health insurance expert, who's going to talk about what members need to know to make the most of their health insurance. Thanks for being here.
Hey, thanks for having me.
Let's start with how BlueCross understands members' needs. How do we know what our members want?
So the number one way is we ask and they tell us. So I'm a customer experience professional, and there's even a word for this type of data. It's called voice of the customer data, or VOC, and it's very important. So if you ever are asked to complete a survey by a website, mobile app, phone, etc., for BlueCross, your feedback comes directly to a team like mine, and we call that VOC data. But we use it for everything. It's very powerful. So we ask, you tell us, and we use it in lots of ways. But we also look to employers and independent agents and healthcare providers. They're constantly sharing feedback with us about their own experience or what members experience when interacting with them. So all of that is important as well. And when I talk about VOC data, it's not just the surveys that we ask people to complete. It's also what people share on social media, places like that. Anytime we can pick up on listening to our members. We also, my team in particular, manages an online research community called the Member Panel. And we do lots of different studies of all types. We have a very highly engaged group of members who are willing to participate in research on specific topics and share what they think, what they feel, share their stories with us. So all of that comes straight in, and we use it to better understand what matters most to our members.
Would you say the key takeaway there is that we care about what our members are going through, and we're listening to them, and we're here to help have a better experience?
Absolutely. It is accepted that VOC data is such a powerful thing. Everybody is looking to it to steer decisions, to prioritize, and to just understand the stories of our members. Another way that we gather feedback is working really closely with our frontline staff. So when I say frontline, I'm talking about our customer service teams, the awesome people who answer the phones every day, the customer service advocates. We stay closely connected to them to say, what are members calling about? What's on their mind? What are the new topics coming up that we need better answers for? So all of those things combined, we are constantly listening to what our members have to share.
So what are we hearing? What are some of the most common things that people are questioning or want to know about their health insurance?
So I'd say overall, when we talk about frustration, number one, healthcare insurance terminology are
It's complicated.
It's complicated. So the jargon that we use, we get it. Look, we didn't come up with it. We understand it's confusing. You know, we all are part of the healthcare system. We all need healthcare. We all use health insurance, but yet the language is very complicated, and we get that. So we are constantly looking for ways to explain things in simplified language to meet people where they're at. We do not believe that you should have to be a health insurance expert in order to use your benefits. So we're trying to always find ways to simplify this terminology, even though we can't get rid of it, because again, we didn't come up with it. It's how we communicate across this very vast healthcare system that we work in. So I'd say that's a number one point that we're always working to address. Another thing is a demand for transparency in our processes. Like, look, we get it. If you're waiting on an authorization from your insurance company to get care, You want to know what's going on behind the scenes. And that's exactly why we built the prior authorization tracker in My Health Toolkit. That was based on VOC data. We knew it was a huge need to have members feel like they're part of that process. So you can literally go in and see if we've received the authorization, where it's at, where it's going. We're doing a lot of work right now around the claims experience. People want to know what's happening with my claim behind the scenes, or how to understand how it was paid. So again, going back to that jargon that confuses people, we're doing a lot of work right now to really break down the claims experience to feel so that members can feel like they're part of the process and to understand exactly how it was determined who owes what.
It doesn't stop there, though. You also then take what you've been working on, and get member feedback on that, right? Like, it's not just this is what we think it needs to be, right?
So not only do members help prioritize what we work on by telling us what matters most to them, they help build it with us. So just about any enhancement, feature, anything you see on our website or mobile app, members were involved in early prototypes of that, sharing feedback. And we test everything. Just to give some examples, we recently had a member panel study where the participants helped us relabel our provider directory, the labels that we use in particular for behavioral health and mental health, telling us, what makes sense to them in that scenario. The survey that I referred to, we tested our survey through a survey. And I know that sounds silly, but that's how much we care. We just relaunched our web surveys, and early on in that process, we engaged our member panel to say, which order do you want the questions in? Does this language match the reason that you're visiting the website? We really want to get it right. So we test everything, and then we bring members back in as we make enhancements too.
And it keeps going from there too, right? If something's not working, then it's reevaluating what doesn't work about this.
Yes, an iterative process is what we call it. But yes, members, we are here for members. And so we bring them in, we co-create. There's another fun solution, name of a term that we use. But yes, very, very important to what we do.
Okay, so let's shift a little into those understanding your insurance basics, right? That's kind of what you said. People really struggle with that sort of thing. What do you think is the most important thing people need to understand about their health insurance?
So there's a few key terms. And, again, I wish we could come up with different ones. It is what it is. Understanding a couple of them, though, is really going to help. I would start with, and by the way, this is something I do constantly with my own friends, family, anybody who knows me. I will sit down with and explain how their insurance works. But I'd start with your deductible. That's where I think a lot of the confusion starts. So your deductible, not just the amount. So in health insurance, it is an annual amount that you pay toward. It's cumulative, so as you pay, it adds up throughout the year, which can be a little bit different from, say, homeowners insurance. So that point gets a little bit confusing at times. But start by understanding your deductible, not just the amount, but take a look at which services are even subject to meeting a deductible. If you have let's say a PPO plan, some of the services are only subject to a copay, right? So taking advantage of those things and knowing if you have the type of plan that's going to require you to fully meet your deductible up front, or if you will only have a copay for certain services. So let's explain copay as part of this. It's like a cover charge or an entrance fee, right? So an upfront set dollar price for going into some place, the type of doctor, the facility. That might be all that you pay, right? That cover fee for going into some place. But oftentimes, once you're in some place, there's a lot more that goes on. And that's where the additional dollar amounts come into play, and why it's important to understand these additional terms. So coinsurance, that's another one. People are looking at their benefits and going, what are all of these? Coinsurance, it sounds scary and weird, but all it means is that's when your insurance splits the bill with you. So when you look at the way that your benefits are outlined, look at, okay, this service, copay, just set dollar amount, got it. this service, subject to meeting my deductible, okay? This, my coinsurance kicks in, and it'll usually be a percentage, and that's just when we start to split the bills with you. So it is a little wordy. It's not words we would use in other parts of our life, but but understanding them can really help you feel more confident about going to get care.
And that's also wholly different from a premium.
Exactly. So your premium is what you pay on a monthly basis or out of each paycheck to have insurance. And a key concept in the way that health insurance works is typically a plan with a higher premium, right? Higher amount that comes out of your paycheck or that you pay monthly. Higher premium is typically a lower deductible. Higher deductible is usually a lower premium. So there's a trade-off. And if you have the option to choose between plans, doing a little bit of math and understanding what your family needs can really help you choose the right plan.
That was my next question, was people shouldn't, like, when should you try to understand your health plan? Like, before you get it, or, the middle of the year and you're stressed out about your bills or whatever?
So yes, we of course we want people to understand how it works at the time of enrollment when you're choosing plans, especially if you have the option to choose between more than one type of plan, because just a little bit of math and a little bit of reflection on how you used insurance in the past year or what your family needs are. Looking at that up front and kind of seeing how it'll play into the different plan types can really help you make the best choice. But we acknowledge not everyone has the option to choose between various plans. Perhaps you're covered by your employer and you only have one option.
Right.
Even then, understanding how your plan will work is really important. Going back to that, what is the thing that I want? Is it a copay, or am I on a high deductible plan where I can expect to pay out of pocket until I reach my deductible? We don't want anybody to be blindsided at the beginning of the year or going to the pharmacy counter in January. We don't want that. So understanding how everything works ahead of time is important. But there's another term that I didn't hit on that plays into this as well. So network, right? Network sounds like a scary term, I think, to a lot of people because they think about gatekeeping or, oh, I'm going to find out my provider's not in network. I can't go there. But let's
hear horror stories.
Horror stories, right? Right? Absolutely. But network, the way to think about it is it's a contract, right? It's a contract between your health insurance company and the healthcare provider. And in that contract, it has a negotiated rate, a lower rate that you will pay. So if you're on a high deductible plan, for example, going to an in-network provider and being covered by Blue Cross, you're still going to pay a lot less, right? Also, a key point about network, in that contract with healthcare providers, it also states things like they will file the claim on your behalf. So if you see an in-network provider, they are expected to file the claim. You do not have to file it on your own. It should work seamlessly in the background because we've already set up a path of communication with that healthcare provider.
You were talking about not being surprised, but it's not just about not being surprised. It's about members being their own advocates and knowing, like, okay, if this doctor's in network, then I want to go there versus here, or like being in control of your own healthcare.
Yes. So you were asking about, when's the best time to understand your insurance planning. So at that time, I also recommend planning for care early on in the year, knowing who's in your network and knowing where you would go for different scenarios. Again, we want you to feel empowered. The last thing we want is for somebody to be needing care in that moment and feel like their health insurance is a barrier. We want to be helping you get the right type of care. So at the beginning of the year, maybe run through some scenarios with your family. If it were an emergency, where would we go? Now, granted, you don't have a whole lot of choice. We're not expecting you to pause and look at who's in network if you're in a true emergency. But know where the closest ER is and kind of get a feel for that. But then there's urgent care. So urgent care is, I need to have something in the next day or 2 days, but it's not a true emergency, right? It's not life-threatening. So if you woke up tomorrow and you felt terrible and you think that you need to see a doctor and you don't want to leave your house, you may have telehealth options. Knowing what your options are under your plan, the majority of our members do have telehealth for urgent care. Planning ahead of time, knowing that that exists, can really help you in the moment, save money and not have to, kind of run around looking for the closest urgent care.
Go wait in a line somewhere.
Yeah. And your primary care physician. That's huge. At the beginning of the year, find that primary care physician. If you don't have one today, don't wait until enrollment. Know who your PCP or your primary doctor is. Find someone who's in network and make sure that you have a relationship, an existing relationship with a primary care doctor.
Well, so let's shift to like how people can know these things, right? Talked about it's important to know and understand your benefits. So how do you find that out?
So, My Health Toolkit I mentioned before. So we have a wonderful member app / website, however you prefer to access it. Your My Health Toolkit account has a ton of information in there. It has everything from your digital ID card to listing your benefits to a tool for finding a doctor. Tons of resources in there. So make sure that you've registered for My Health Toolkit, have the mobile app on your phone. But certainly if you have a question, it's never the wrong time to call us if you're not finding it through My Health Toolkit, right? We have teams standing by, ready to help. They're great. So reach out to us if you have questions. We're happy to help.
And one of our like little tips, like a little hack, is to know to call the number on the back of your card. Don't Google the phone number,
Yes.
right?
We did a whole video about this, and it sounds a little bit silly, except let me explain it. It is very important. We are a big company, and not just that we're a big company, but we have a lot of teams that are specialized in caring for our customers, meaning they are trained for specific types of health plans. If you have a health plan off of the exchange through healthcare.gov, that's a team that's trained to understand, speak to those benefits. And then we have lots of different employer groups, customized coverage. You might have a team that is specialized to speak to your coverage for your company. We have Medicare Advantage. We have all of these different teams supporting different types of plans. And what we were seeing is a lot of people Google BlueCross, and you will get a phone number.
Yeah.
And we will do our very best to get you where you need to go as quickly as possible. However, the easiest thing to do is to take your member ID card, your insurance card, flip it around. It should be the top phone number, customer service, and call that number so you can go directly to the team that specializes in answering your questions.
And you said this earlier, if you don't have your member ID card, I mean, it's hard to keep track of all these things. You can find it in the app.
Absolutely. And in fact, there's a feature on the front of the mobile app to where you don't even have to be connected to the internet. You can just tap it and see your digital ID card. So if no other reason to have our app on your phone, have it for your insurance card to always have it on you.
You know, one of the things that I found really helpful about that is you go to see a doctor and they want proof of insurance, and I just have a screenshot on my phone and I can like send it to them so easily. It's like,
Yeah.
my card.
Even if you're sometimes wondering at the beginning of the year when they ask you to update your information, like, did it change? Your My Health Toolkit account is always going to have the most current version of your insurance card on it. So that's another reason to reference it. Even if you're feeling confident about your paperwork, you didn't think anything changed, check it.
Okay, so you've got your information, you've got your ID card, you know how to get in touch and what's covered. What should people know before scheduling an appointment or having a test or procedure?
I'm glad you asked. So making sure your information is up to date with the doctor. I know we touched on that, but I want to reiterate the importance of not just your current member ID number, but if you're seeing a new doctor, the spelling of your name, the date of birth. I've seen little things like that kind of draw out the claims process because one thing is off and it goes back and forth, or it might come through like you're not covered. We don't want that. So it is so important to make sure your information is up to date with your doctor. Now, as far as things to know when planning care, you do have the ability to shop and compare. Just like you would shop for other things in the world, you can do that for healthcare. I think it's a little bit uncomfortable, right? That's not the way that we're used to thinking. And let me be clear too. We really promote and encourage having that primary care doctor that you trust, that you look to. I think that is the most important relationship that you can have. So have a PCP that you trust that's in network. But what we're used to is that doctor kind of driving the direction of everything. So they're telling you what test you need or what specialist to, referring to a specialist and so forth. And they are the one conducting your care. You should follow their guidance. However, when it comes to having a lab test, a procedure, especially lab tests, seeing a specialist, you can shop and compare. You have that right as a patient if there's someone else you want to see, or if you know that it's much less expensive to have something done here and have the results fed back to your primary care doctor. I'll give an example. I always use examples from my own life. If you don't know me, now you know. I had to have a CT scan a few months back, and because I have a certain allergy and because it was, time sensitive, I had to have my primary care doctor, whom I love, actually refer me to a different health system who I was then working with and trying to find a location that could get me in quickly. I was able to do that. All of that to be said, I ended up going to what we would consider a freestanding facility. If I had not been through this process, I probably would have been sent on campus to the main hospital to have the CT scan done. But because I ended up at a freestanding facility, there was a $700 difference in the cost just by chance. And that was kind of a wake-up call for me. It was the same type of test, whether I had it here or there. The results were being sent back to my primary care doctor. The person performing the test is a professional tech, but the cost difference is huge when you choose the facility type.
And it's still in network.
It's still in network. It is the type of facility. Just like shopping in any other world, costs can vary significantly. And we want members to know that so that you feel empowered to choose. And it might feel a little bit uncomfortable, and it is worth having that conversation with your doctor that, hey, can I have it done here versus there? And not just automatically feeling helpless or just going with wherever you're referred to if you would like to shop around. Same with a specialist. I think most primary care doctors have a specialist in mind when they refer you for specialized care. You as a member, as a patient, as a consumer of healthcare, you do have the ability to shop around, to look, compare, ask for feedback, and say, this is, I really want to see this one, and ask for a referral to a specific specialist. That's another way that you can choose care.
And do we have tools that help people do that?
Absolutely. So going back to My Health Toolkit, so you can log in, go to find a doctor, and we have a directory where you can shop, compare, you can see cost estimates, you can see who's in network. And again, they can all be in network, but the cost can significantly vary. And some of our members have very specialized plans through their employers where they really want them to go to, this place versus that place. So it really is worth it to see how costs are structured.
And you can also see that on the medicine side as well when you're looking at your drug prices, your pharmaceutical.
Absolutely. Yeah. So you'll go into the prescription drugs section of My Health Toolkit. And that is if you have pharmacy benefits through us. Okay. Many of our members do, but I'm just throwing that out there that sometimes if you have employer coverage, for example, and you will see when you go into My Health Toolkit whether or not prescription drug benefits are included. But we have the same type of tools that I just referenced for comparing prescriptions. Mail order, you might save a significant amount, or Going to pharmacy A versus pharmacy B or C, you can see the cost variation there as well.
You've already shared so many helpful tips, but what are some common mistakes that people make when using their health insurance that you think would be helpful to understand so that they don't feel so lost or confused?
Great question. So common mistakes, well, we've already covered, please don't Google us, call the number directly or go to My Health Toolkit. But I'm going back to that concept of in-network care, and specifically the part about doctors that are in-network filing claims to us directly, right? That's part of the process. If you receive a doctor's bill, make sure when you look at it that it shows insurance being applied, right? So I've seen it happen. It can be a mistake. It can be an oversight. We see it a lot with newborn care. Yeah. Where something gets filed, make sure that insurance has been applied to that bill. So that's step one. Step two is, okay, you see that insurance has been applied. You're going to go into My Health Toolkit and you're going to pull up the EOB or explanation of benefits for that care and compare the two prices. They should match. Sometimes you may have two EOBs for one doctor's bill, but overall, the numbers need to match. And if they don't, contact your provider, contact us, both of us, to work it out. If they are in network, the EOB needs to match the amount that they're asking you to pay. That is part of the contract.
And one of those tips is don't pay the bill until you've gotten that EOB, right? Just because you get a bill in the mail doesn't mean you have to pay it right away.
Right. So when processes are working as they should, usually, generally, you would get the EOB before the bill because the EOB recaps the conversation between your insurance company and your provider. We had that conversation. That's what generates the EOB and the bill. So they should come at the same time. The EOB, if you're signed up for digital EOBs, will come quicker. But if you get a bill and there's not an EOB to match it, how do you know that they have spoken to your insurance company? It's kind of like a receipt of communication between the two of us. So we really want to ensure that you're matching those amounts any time before you pay a bill. Now, copays, going back to those terms, the cover charge, those typically get paid up front. That's that amount that they will often ask you for at the time of your visit. Some providers may request prepayment for certain things. Generally speaking, matching that EOB to the bill is the way to ensure your insurance was applied properly, and also to kind of scan it. Look for what's reflected in there. You know the care that you received. If something doesn't feel right, look right, you can speak up and ask for more explanation. The other thing that I think, I wouldn't say a mistake, but I would encourage is people do not take full advantage of what's included in their benefits. So there's a lot of stuff you may not think about. I'll use an easy one. Blue 365 is a program for all BlueCross members, and it's discounts on everything, like athletic wear to wellness programs to, I think there's stuff to do with pets on there, gym memberships, all kinds of stuff just for being a BlueCross member. And take advantage of those discounts. I'm going to say it again. It's in your My Health Toolkit app. You can see the types of programs that are included. We have a lot of digital wellness programs, a lot of options for virtual care for specific types of conditions available to some of our members. So check it out and make sure you know what's included in your benefits. The last thing I'll say is don't ignore our phone calls. So we've talked about how to get in touch with us, but the other thing I see is people being afraid to pick up the phone for BlueCross. We are not bill collectors. If we are calling you, it is most likely to offer you additional support for what's included in your insurance. For example, a care manager, or sometimes called a case manager or health coach. If we believe that you could benefit from working with one of those types of professionals, we may be calling you to try to offer up this resource. And I think people might be afraid to pick up the phone, and that's fine. They'll leave a message, call us back. But really make sure that you know what's included in your benefits and you're taking full advantage of the support we make available.
On that note, having all these awesome tools and resources available, it does vary, right? So like, and same thing is true for like the network or how much it costs, right? So your plan might be different from your neighbor's plan.
Yes, we did a video on this too, but please do not ask your neighbor what's covered. Talk to your neighbor, talk about Blue Cross, that's fine, but don't ask them specific questions about your benefits. So plans can be highly customized. We touched on it, but employer plans, especially if you're covered by the company that you work for, they can greatly customize how the plan works because they know their employee population. They can customize it so it's best for them. And because of this, each plan can look a little bit different. If you get your health insurance from healthcare.gov, from the marketplace, that's going to be one type of plan. If you are getting it through your employer, if you are getting it through an independent agent, there's all these different plans. And what we often see, I picture a social media post. I have Blue Cross. Is this covered? Or I have Blue Cross. Is it? That is such a broad statement. And, we really want to give you the right answer. We do not like people feeling blindsided or feeling confused. So yes, plans highly customized. Please come to us or My Health Toolkit to get answers, not your neighbor.
Okay, so you know what your health insurance includes, you know your plan, you've shopped around. What is something people should do to prepare for a doctor's visit from their insurance standpoint?
So going back to having that record up to date, I think most providers, many of them, are pushing you that pre-registration. Hey, make sure your stuff is up to date. Check the member ID that's listed, check the spelling of names and so forth. Make sure that they are in network if you have that option at that point in time. But also making sure you have the app on you in case they want to see the ID card again, and looking at your benefits. So I know that, this is where we get a little bit into the terminology and the jargon that makes people nervous. But if you are going to the dermatologist next week and you want to know what to expect, looking at your benefits, it might say something like $70 copay or the amount of coinsurance. Have an idea of what it might cost you so that you feel more prepared going into it.
There's some types of care that are included in your plan, right? That's a part of understanding your benefits.
Mm-hmm.
And so maybe knowing that and understanding how you maybe have a copay, but for certain types of care, it's different, right?
Yes. Yeah, and that it's often listed out. So in My Health Toolkit, you would see it called out separately as preventive care. In your benefits booklet, usually called out separately. But there are certain services that are covered in full for many people with a health insurance plan to ensure that they're staying on top of their health. And that would be another recommendation in preparing to make the most of your health insurance during the year. Know what preventive care is right for you. So it's typically by gender, by age, risk factors. There are certain things that you need to be staying on top of. Screenings, cancer screenings, things like that.
The flu shot,
vaccines. And, I'll speak to this as a mother, right? I am really good at staying on top of her appointments.
Yeah.
My husband's going to get care. My daughter's going to get care. I sometimes forget to schedule mine. And then you're scrambling and you're trying to, it's one way to invest in yourself and make the most of your insurance. What preventive care do I need this year that's recommended, medically appropriate, and schedule those appointments, because that's how you make the most of your health insurance as well. There are a lot of things that are typically covered in full because we really want to ensure you're staying on top of care.
One of the things that sometimes we hear are that those visits might get billed incorrectly, or like preventive care should be covered. Is it covered for everybody?
So I don't want to make a blanket statement. There are certain scenarios and it can get customized by certain plans.
Okay.
So always check, don't assume. But if you were told and you knew that you got preventive care that is appropriate for your age, gender, risk factors, sometimes if it comes through. If one or two parts are coded incorrectly, if you get a surprise bill for something you were expecting to be covered in full, the least you can do is reach out to us and make sure that it's processed correctly. Give us a chance to look at it with you if you feel like something, isn't right, and we'll walk through it with you. Sometimes it is, an error. Other times there was something performed that wasn't truly preventive care, and that's where the cost comes in.
Do you call your health insurance or do you call the doctor's office?
So it could be either, but I would say to call us to get it straightened out. And a lot of times we'll get on the phone with you and your doctor so that we're all communicating. We work closely with our provider community, and we want to get it right for our members, their patients. And sometimes it's just, one thing that wasn't coded correctly. I won't say that that's always the situation, but I do encourage people to reach out. As I look at VOC data every day, voice of the customer data, we see a lot of comments around that. And so, it had us raise the question and go to our partners in our contact centers and learn more about this. And they are often, I wouldn't say often, but they do sometimes have the ability to revisit the claim and say, okay, this is the thing that needs to be adjusted. It was preventive care. What we don't want is for someone to feel like they were tricked or that their coverage isn't acting as they thought it would. The least you can do is reach out to us and walk through it and say, is this right?
I think something I've talked to you about in the past too is like that's where the prior authorization can work to your benefit, right? I think some people get frustrated with the prior authorization process, but it can be a benefit in that way too, especially with those like cancer screenings, right? And if you fall into a category where maybe you need to be screened earlier, if you get the prior authorization, it makes all of that easier.
Yes, it's kind of setting up the path for the claim to come through, as long as it's submitted and it is this type of care, it is from this provider. Yes, it's a little bit of extra effort on the front end to make sure you get that authorization. We'll make sure that things come through smoothly. Not always required, but it is one way, that you can build confidence about getting the care.
Yeah, you just want to make sure that it's going to be done correctly.
So as we're talking about preventive care and staying on top of what's right for you, again, we're not trying to add extra stuff to your plate. It's a busy world. People don't wake up thinking about their health insurance, much to my dismay. But we get it. So another recommendation I would make is having your My Health Toolkit account and making sure that you've signed up for notifications, whether that's email or text, what your preference is, for the types of communications that we send you. We do our very best to send personalized messages. We don't just send blanket messages to annoy you about, general topics. We will message you if you are overdue for one of the main screenings when you meet the criteria, a physical, dental cleaning. If you're living with a chronic condition like diabetes and you are overdue for certain tests that are recommended to help you be at your best, we may have notifications set up for those. So we try our very best to be your partner and staying on top of your health because we know it can be a lot and we're here for you.
Yeah, how many times you forget like, oh, I need to have my annual visit this year. And it's like, here's the reminder.
And when was the last time I got this thing? Well, we know because we have your claims data and we use it to help you, to remind you when you're due. Again, we want you to get that appropriate preventive care.
We've talked about different types of care and shopping around for care. One of the things I know just because I work at BlueCross is that telehealth is available and a lot of people think that it isn't. Is this something that's widely available to our members?
Yes, absolutely. And we know that it's for those that have gotten comfortable with using it, it can be a game changer for a lot of people, especially when you don't feel well, especially if it's one of your kids and you don't want to go to that waiting room where there are lots of germs and you just don't feel well. So we do have a number of telehealth solutions available. I would recommend to anyone to go into our app, look at the section for Find Care. It will direct you to the telehealth available to you under your specific plan and create an account for using that telehealth platform in advance. It only takes a few minutes, but it's just like going to any other doctor's appointment where you need to, what are your allergies? What medications are you on? Oftentimes that will feed over for you from Blue Cross. But go ahead, create that account for you and your kid if applicable. And that way, when you need to use it, it's just tap, 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 and you're in queue to see a doctor through your phone or laptop, whatever it may be. Doing that in advance really helps because when you're feeling cruddy or your kid is, the last thing you want to do is paperwork or, registering at that point. So if you think of it, take a few minutes, do it in advance.
And another important fact about that is it can help you avoid those wait times at like an ER, right? If it's late at night, this is available 24/7, right?
It is weekends, holidays, so the same type of hours of it as an ER, different use cases. So to be clear, life-threatening or a broken bone, things like that, we cannot help you through telehealth. Cold and flu symptoms, we have a whole list online. It's easy to see. So when appropriate, telehealth can be a great, great solution, especially when your doctor's office is closed. So we've seen a lot of adoption for telehealth in the years, especially since COVID, and we see it continuing to grow. We continue to see great, appropriate uses for it. We are very intentional in what we promote for telehealth and what we do not promote for telehealth. So we want you to get the best care, and sometimes getting that virtually is a great option.
Okay, so we've talked about a lot of different things with health insurance, but if someone was going to take away one thing, what do you think is like the number one thing you want people to understand about their health insurance so they can get the right care for them?
So I'm going to go on a different path for this one. What I really want people to take away as a customer experience person. So my job is to tell the stories of our members, to understand our members, to give them a voice. I want people to know that we are a company of people who care deeply about the customers that we serve. And, working in health insurance, I know what some people, the picture they have in their mind of people in a closed room who are, disconnected, making decisions to make things harder for people. At Blue Cross, that could not be further from the truth. We care deeply. It's why I have this type of role, right? I'm expected to give a voice to our members. We are a company filled with healthcare professionals, medical professionals. Let's take me as an example. I actually report up to a physician, and our medical decisions, guidelines, policies are determined by medical professionals, right? Authorizations, if they're not kind of automatically approved, if they have to be reviewed by someone, they're being reviewed by a registered nurse. These are medical professionals behind the scenes here. And we are a large company of people who work in a complicated industry, and we get that. But we want to make it right. And nothing makes us happier than turning something around for a member who's going through something, helping them get the care they need or the solution, having a great experience. That's what makes us happiest. And so I think we've all been involved in, a member problem comes through, a question. People jump so quickly onto trying to make it right. Okay, who can fix this? Who can reach out? And with enthusiasm. That is one of our greatest joys when we can really turn it around. We know that the work that we do matters. We know that it's incredibly personal to you, to the lives of your families. So just remember that. We are also your neighbors. Blue Cross is located here. So, in fact, most people probably know someone who works at Blue Cross. That usually happens. Talk to someone and they all know someone who works at Blue Cross because we are a big company who has served South Carolina for many, many years. And we care. So I want people to keep that in mind and remember that with whatever they're facing so they feel comfortable and empowered to reach out to us if something does not feel right.
Yeah, I actually have talked to a number of our customer service advocates, And a lot of them said one of the things, like one of the reasons they chose this job was because they felt like they were helping their neighbors, right? They felt like it was like making a difference in people's lives. And it's not here just to be like, I don't know, the big bad guy in the room.
Certainly not at Blue Cross. I can't speak for everyone, but I can speak for being here at this company for 13 years and the amount of amazing people that I have seen working really hard to make things right for the people we serve. And we do. We truly do that every day. So whatever you take away from this, know that we have, we want our members to get the care they need. We want members to live their healthiest life, to feel like we have their back. That's why we exist. So my other thing I want people to remember is to take that survey if you're prompted from the website or mobile app. We know everybody wants you to take a survey, but if you do, your feedback comes to a team like mine, and we're two people who deeply care and really want to hear your feedback, your thoughts, your experience.
This has been really helpful. We've talked a lot about the app, but is there any place where people should go if they need more information, they want to learn more? Where would you like them to go?
So if you're like me, I'll do anything to not get on the phone. Okay, so we know that, if you're anything like me, we get it. But certainly it's never a bad time or a wrong time to reach out to us. If you have questions, if you're covered by your employer, your human resources department might be a great resource for breaking things down for you. But of course, you can always reach out to us through My Health Toolkit or by calling that customer service number. If you work with an independent agent, they might have the answers for you. So if you worked with one to sign up for your plan, we have a wonderful agent and broker community that we work with closely, so they can answer your questions. We all want to help. So it's never a bad time to reach out to where you feel most comfortable. So that's how I am. I never want to get on the phone, but I know that everyone is not like me. And in fact, if you prefer to see someone in person and you live close to one of our Blue centers, you can go there directly. And those folks are wonderful. They have the best staff there. They will happily answer your questions in person, break it down. On top of that, I'm pretty sure they have like bingo nights and Zumba and all kinds of fun stuff. So maybe you want to just go hang out with their staff, but certainly we have the in-person option as well.
Thank you for joining us on today's episode. We hope you'll join us again next time.